Inner-city public housing developments have long been viewed as places of concentrated poverty, unemployment, and long-term welfare dependency. In the mid-1990s, the U.S. Department of Housing and Urban Development, the Rockefeller Foundation, several other philanthropies, and MDRC forged an unusual partnership to tackle this problem. They sought to design and test a demonstration program aimed squarely at one ambitious goal: to substantially increase employment and earnings among urban public housing residents. The program they created is called Jobs Plus. Hello, my name is Jim Riccio. I was Research Director for Jobs Plus, and I'd like to take a few minutes to highlight what we learned in the demonstration. Let me start by quickly giving you three bottom line findings. First, we found that even before Jobs Plus began, employment and earnings among public housing residents grew dramatically, largely in response to the robust economy of the 1990s. This challenges some common stereotypes about public housing residents not wanting to work. Second, when it was fully implemented, and even after the recession had begun, Jobs Plus boosted residents' earnings well beyond what they would have earned without the program, by around $4,600 over 4 years. This represents a 14% increase in their earnings. And third, the program achieved these positive results in some very different cities for some very different types of residents. In other words, its positive effects were pervasive. So now that you know the bottom line, let me explain what Jobs Plus was and where it was operated. I'll then give you a little more detail about the major findings. In designing Jobs Plus, MDRC and its partners drew on past research and created three promising components. First, on-site access to employment-related services. These were services to help residents find jobs or increase their wages and hours of work. They included job search assistance and referrals to education and training, plus support services such as childcare and transportation subsidies. This assistance was available at new Jobs Plus employment centers located within the housing developments. Second, rent-based work incentives. Traditionally, public housing residents have to pay more rent as their income grows, which can create a disincentive against working in the formal economy. Under Jobs Plus, however, new rent policies ensured that people who went to work or increased their earnings did not experience the same jump in monthly rent payments. And third, community support for work. This was an attempt to strengthen social ties in ways that promoted work, such as by fostering neighbor-to-neighbor exchanges of information about job opportunities, employment services, and financial work incentives. In implementing these components, the public housing authorities were to focus on all working-age, non-disabled adults in the targeted housing developments, creating what some people call a place-based program. But Jobs Plus was not intended to be just a housing authority program. Instead, the housing authorities were required to forge partnerships with local workforce development and welfare agencies and with resident leaders to design, operate, and help fund Jobs Plus. After an extended screening process in which 42 large and mid-sized cities across the country applied to be in the demonstration, 6 were selected. They are Baltimore, Chattanooga, Dayton, Los Angeles, St. Paul, and Seattle. We intentionally chose locations that were tough. In order to be selected, each city had to have at least 2 or 3 similar public housing developments with low rates of employment and high rates of welfare receipt. In each of these cities, MDRC then randomly selected one housing development to operate Jobs Plus. The other 1 or 2 developments that were not selected became the comparison developments. This made it possible for us to determine how the residents of the Jobs Plus developments fared when compared to people just like them, but without access to Jobs Plus. Working closely with MDRC, the site spent about 2 years adapting the 3 components of Jobs Plus to fit their local circumstances. Once this transition phase was completed in 2000 and the program was fully up and running, we could see what Jobs Plus was able to accomplish. That takes us back to the findings I summarized at the beginning, and I'd like to explain them a little more to you now. First, note that 3 of the 6 Jobs Plus sites, Dayton, Los Angeles, and St. Paul, implemented and sustained all 3 components of the program: the employment-related services, the rent breaks, and the community supports for work. 2 sites, Chattanooga and Baltimore, did not fully implement the program due to changes in public housing management and other reasons. Finally, one site, Seattle, implemented the program fully for 1 year, but then began a process of tearing down and rebuilding the Jobs Plus housing development, which entailed a large relocation of residents. The first 3 sites I mentioned thus offer us the best test of the Jobs Plus idea. So let's take a closer look at the experiences of all of their residents combined. One striking finding is how much residents' earnings rose over the 1990s. As you can see from this figure, these upward trends began well prior to the start of Jobs Plus and were almost identical for residents of the Jobs Plus and the comparison housing developments. But once Jobs Plus was fully in place in 2000, the Jobs Plus group pulled substantially ahead of the comparison group. This difference, what we call the program's effect or impact, is due entirely to Jobs Plus. Also note the changing size of the impact between 2000 and 2003. Each year, the earnings impact got larger. For example, the average earnings of the Jobs Plus group in 2000 were 9% above the comparison group's earnings. By 2003, this effect had grown to a 20% increase over the comparison group. In other words, the effect of Jobs Plus had doubled in size by the end of the follow-up period. Also striking is the pervasiveness of Jobs Plus impacts across subgroups of residents. Impressively, the program increased the earnings of Latino men in Los Angeles, who are mostly immigrant heads of 2-parent households, Southeast Asian men and women in St. Paul, and African American women in Dayton. It also had positive earnings effects for residents who were welfare recipients and for those who were not, for residents who were recent tenants and for those who were long-termers, and for a variety of other subgroups. This diversity of impacts is important because it shows that Jobs Plus can work for very different kinds of people in very different kinds of places. And this increases our confidence that Jobs Plus could succeed if replicated properly on a broader scale. Finally, the costs. Although MDRC did not do a formal benefit cost analysis of Jobs Plus, we estimate that the extra government costs involved in producing the program's earnings effects, which remember was still growing when the study ended, were probably between $2,000 and $3,000 per resident overall. Let me close by saying that we hope that policymakers and other officials seeking to improve the self-sufficiency of public housing residents will take these very encouraging results from the Jobs Plus evaluation into account. Thank you very much.